I had a patient. She was in her l late 40s, I want to say. She had fairly well-controlled periodontal disease. She was missing several posterior teeth. She was uncomfortable, not, she had some pain. I had been talking with her for many, many months about, you know, her options. Do we try to save teeth and go as long as we possibly can? She had the feeling that, her fate was, the teeth were going to be coming out. It was inevitable. She didn't want to have anything that was going to be removable. She was really looking for some option where she could continue doing her professional career and be around her husband and her kids and friends and family and not feel or look like something had happened. I brought this patient to CSI. It was, as I said earlier, a very high aesthetic driven case, and I wanted to make sure we had a slam dunk case with this. And we removed her remaining teeth and we placed implants on upper and lower arch. And at the end of the day, we had her temporaries in. I was very pleased with the aesthetic outcome. So I feel that we accomplished the goals that we were looking for. So it's nice to be able to talk with your mentor through the case and explain to them like what you're thinking, how you want to handle the case, how you want to move forward with the case, and then having them maybe tweak it or give you the comments like, yeah, I agree, that's the great way to handle this, or we might put this little spin on it. Um, Knowing that you have somebody there to ask questions to, but
Mhm.
then them coming in and telling you, hey, that's great, you did a good job, this is what I would have done. I think it just gives you that extra level of confidence and reassurance that you need to go back to your practice and do those cases. Yeah, you don't want somebody sitting there doing the whole case for you because that does not help you. I think you need to be able to do the case with somebody there, not necessarily in the room the whole time, but you have the ability to go ask somebody some questions if you need to. I feel like you guys always, in my only two times of being there, I feel like the curriculum is always being advanced, and the information that you're disseminating seems to always be improving in more detail. And it's nice to be able to have that. So when you come back to your practice, you have something to refer to. Coming away from CSI, I just did a case yesterday where I took out, 13 teeth on a guy. We've been working with him for quite a while. He's a VA patient. Took out his remaining 13 teeth and, did a bunch of, alveoplasty, and I placed 8 implants on him. Did the entire case in about probably 3.5 to 4 hours. What I learned at CSI was very beneficial yesterday to help me with that case. I mean, I was very efficient, did some things that I learned with Dr. Mitchell down there, and Dr. Caldwell. And I can't say enough good things about those two. Um, Dr. Dune, Dr. Brisky they're amazing at what they do. I really have a ton of respect for them. So yeah, I could go on and on. I'm just grateful that you guys are you're only an hour and 45 minutes away from me. Honestly, it kind of felt like a natural progression for me,
Okay.
um, to kind of come attend CSI, get a feel for the environment, kind of get to know some of the mentors. I already knew a few of them from other classes I've attended, but then I didn't realize it was going to feel like a natural progression, but it ended up being that way. And so I think anybody on the fence of like, well, man, I really don't know if I know enough to do this. I think the best thing you could do is, identify a patient or two, um, and maybe a difficult one, because those are the ones that, you want to be able to get some help with. Then you come back and do a one-on-one mentorship, to gain that next level of confidence.